Hello everyone. Today, we're exploring the medication loperamide, commonly known under the brand name Imodium. This discussion is designed for educational purposes. For specific health-related questions or concerns, always consult with a healthcare professional. Description: Loperamide, marketed under the brand name Imodium, is an oral medication categorized as an antidiarrheal. It works by slowing down the movement of the gut, which decreases the speed at which the contents pass through, allowing for more water to be absorbed from fecal matter. Loperamide is primarily used to treat sudden diarrhea, including traveler's diarrhea. It is also utilized for managing diarrhea associated with inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, under doctor supervision. Additionally, loperamide helps to reduce the amount of stool in people who have had an ileostomy, which is a surgical operation that creates an opening in the abdominal wall through which waste is diverted from the intestines. Warnings: Loperamide should be used with caution. It is not recommended for children under 2 years old due to serious risks of respiratory problems and deaths. People with a history of allergic reactions to loperamide or who have abdominal pain without diarrhea should avoid this medication. Additionally, it should not be used by individuals with bacterial enterocolitis caused by invasive organisms including Salmonella, Shigella, and Campylobacter. Those with a history of colitis should consult their doctor due to potential risks of toxic megacolon. Before taking this medicine. Before taking loperamide, discuss with your healthcare provider if you have a fever, mucus in the stool, liver disease, or if you are pregnant or breastfeeding. It is important to inform your doctor about any other medications you are taking, as loperamide can interact with certain drugs, including antibiotics and antifungal medications. Side effects: While effective for treating diarrhea, loperamide can cause side effects including constipation, dizziness, and drowsiness. More serious side effects are less common but can include severe constipation, severe abdominal pain, or signs of dehydration such as thirst or dry skin. There are also reports of heart problems such as fast or irregular heartbeat in those taking higher than recommended doses. Always contact your doctor if you experience these symptoms. Interactions: Loperamide may interact with other medications, potentially altering their effects. It is crucial to inform your healthcare provider about all the medications, supplements, and herbal products you are using. Special attention should be paid when taking loperamide alongside medications that also slow down gut movement or those that are metabolized by liver enzymes, as it may increase the risk of side effects. Dosage: It is vital to follow the dosage instructions provided by your healthcare provider or indicated on the package for over-the-counter use. For adults, the usual dose is 4 mg initially, followed by 2 mg after each loose stool. The daily dose should not exceed 16 mg. For children, dosages are lower and depend on weight and age. Avoid: While taking loperamide, it is advisable to stay hydrated by drinking plenty of fluids. This helps to replace electrolytes lost due to diarrhea. It is recommended to avoid driving or operating heavy machinery if you experience dizziness or drowsiness from the medication. FAQ: A common question about loperamide concerns its long-term use. Loperamide should not be used for prolonged periods unless prescribed by a healthcare provider, as it could lead to dependency or worsen the condition it is meant to treat. Closing: That concludes our session on loperamide. Remember, this guide is intended to provide educational information and is not a substitute for professional medical advice. For any questions or concerns about using loperamide, please consult your healthcare provider. Thank you for joining today's discussion.